Hi, my name's Lisa Allen and I'm the interim named nurse for CWP Safeguarding Children's team.
And my name's Gina Parkin. I'm Family Nurse Partnership Supervisor for Start and Well 0 to 19 for Cheshire and Wirral Partnership.
And we're here today to talk to you about the Pan Cheshire Safe Sleep Risk Assessment Tool. We acknowledge that safe sleep can affect everybody and there may be some content within this presentation that you find upsetting. We urge you to look after yourselves and take the time that you need. And if you do need to seek additional support, please contact the relevant person within your organisation, your workforce wellbeing or staff support. Thank you. So, the aim of the presentation today is to share some key messages around safer sleep for babies to reduce the risk of sudden infant death syndrome. We're going to explain and promote the Safe Sleep Risk Assessment tool to help us embed safer sleep as everybody's business. We will also provide links to resources and additional support and information. So, sudden unexpected death in infancy and safer sleep. What are the local issues and how do we make a change? The reason we're here today talking to you about safe sleep was prompted by, sadly, a child death back in September 2023. The child was a resident within the Nottingham area and was staying in Cheshire West and Chester at the time of its death. And sadly, there were modifiable factors such as unsafe sleep practice that were identified during the rapid review process. The 5-month-old baby was out of routine, staying with grandparents. They shared a bed with their siblings and their mother, and the baby was found unresponsive. At the time, the room was found to be an excessively hot temperature, and there was adult bedding as well as co-sleeping that contributed to the unsafe sleep factors. As part of the rapid review process, Nottinghamshire County Council had identified the Safe Sleep Risk Assessment tool and were piloting it at the time. We have adopted that Safe Sleep Risk Assessment tool and we are here today to talk to you about how we can indeed make safe sleep everybody's business and incorporate this multi-agency risk assessment tool into our everyday practice. So, Pan Cheshire. There have been a total of 199 deaths in children under the age of 1 within Pan Cheshire from November 2019 to the current date. 166 of those deaths, the cause was known at the time. In 33 cases, sudden unexpected death was identified. 11 of those had a cause identified after a thorough post-mortem, and sadly, 22 cases, the cause remained unknown. Sudden infant death syndrome is a diagnosis of exclusion applied to cases in which an infant's death is sudden and unexpected and remains unexplained after a thorough post-mortem and investigation included 1. An autopsy by an experienced paediatric pathologist, 2. An investigation of the death scene and the circumstances of the death, and 3. Exploration of the medical history of the infant and the family. In those 22 cases that occurred in Pan Cheshire, 82% had unsafe sleep factors present. That's 18 out of 22 cases, which is quite a stark finding. And in those 18 cases, those unsafe sleep factors could have been modifiable. Another stark statistic.
So SIDS claims the lives of approximately 182 babies every year in the UK, and that's around 3 babies a week. Sharing a room with your child can halve the risk of sudden infant death. An infant placed on their front to sleep is 6 times more likely at risk of sudden infant death than those placed on their back. The rate of sudden infant death in England and Wales reduced by 81% since the Back to Sleep campaign and message was launched in 1991. Around 89% of sudden infant deaths happen in the first 6 months of life. 63% of unexplained infant deaths were in boys in 2021. Babies born with a low birth weight are 5 times more likely at risk of sudden infant death than babies born in a normal birth weight. Sleeping on the sofa with your baby can increase the chance of SIDS by up to 50 times. And over a third of SID deaths could be avoided if no women smoke during pregnancy. In 2021, the SIDS rate was almost 4 times higher among those mums under 20 compared to those of any other age groups. So just to identifying any increased risk factors, so prematurity, low birth weight, the age of the infant, male sex, prone sleep position, overheating, maternal age, parental drug use or alcohol use, unsafe sleep environments, and co-sleeping with known risk factors present, and the unsafe use of products.
The unexplained infant mortality rate has generally decreased since 2004, so those rates are coming down. However, there is still more that we can always do to reduce the risk of sudden unexpected infant deaths and promote safe sleep at every opportunity.
So this slide just gives us an overview of co-sleeping risk factors. So advice on co-sleeping risks have not changed. If there's any identified risk factors, then we should advise parents and carers not to co-sleep. However, we do deliver this information differently. Families should be aware of any risks that increase their risk to baby and make safe decisions for their baby. So that includes bed sharing with an adult who smokes, has been drinking alcohol or taken recreational drugs, bed sharing on a sofa or armchair, and as we've said before, the risk is higher for those infants born prematurely or of low birth weight. Bed sharing with a breastfeeding mother with none of the above risk factors has not been shown to be a significant hazard in any study where this data has been collected. So co-sleeping advice is to create a safe, clear space within the bed. So that is to keep pillows and adult bedding away from the baby, along with any other items that can cover a baby's head or cause them to overheat. Many babies who die from SIDS are found with their head covered by loose bedding. Another bit of advice is not to bring any other children or pets in the bed with you. This will help reduce the risk of accidents, and to make sure that the baby cannot become trapped in any bed frame, headboard, or fall out of bed, maybe get trapped between the mattress, a wall, or a radiator, and to never leave your baby alone in an adult bed. So it's important to consider any risks present in an adult bed that may pose a risk to the baby whilst you are co-sleeping. This is a good visual. Again, it's a resource from the Lullaby Trust. It gets a conversation going with parents or carers and families, just to elicit what their understanding is of potential risks. So you could maybe provide them with this visual and ask them to identify any risks that they see present. And then that can elicit how much information they are aware of, and then you can fill in any gaps that they might be missing. So some of the visuals here around a baby not sleeping in the prone position, baby's on the side with pillows and loose bedding and a hat. There's also a pet present. You can see drug and alcohol paraphernalia on the floor that may increase the risk factors. You've got baby in point 4, baby in a car seat, so that can initiate a conversation around safe sleep and the use of a car seat if the baby falls asleep in a car seat. Then the advice is that you do take the baby out of the car seat and once returning to the home and place the baby in a safe sleep environment. So this is just a good visual resource to get the conversation going of potential risk factors. There's also a good product guide. As we know, there is a lot of products available, and especially that could be promoted and marketed on many social media platforms. So this is a good product guide, just to have that conversation and explore with families, have they bought any products to support their baby to sleep, and that provides an opportunity to say that these are unsafe products, and it gives a guide to safe sleep essentials. So these are just pictures of some of the many products out there currently that are not recommended for a safe sleep environment.
I think that as well, something that was highlighted recently in the media around the baby that sadly died having been strapped to a beanbag in a nursery. This is another example of inappropriate use of products. And I think Gina mentioned, you know, some of these influencers are very powerful, particularly with some of our younger people, where, you know, they are promoting these products. And as professionals, we're really up against it when we're trying to tell them not to use something that the latest influencer is using and promoting, or something that they've spent quite a lot of money on. But it is really important that they are aware of the risks, and we all have a responsibility to be giving those same messages. So, what is the challenge? Taking into consideration, we have 3 to 4 deaths each year where unsafe sleep has been noted. Why are families not following the guidance, and how can we support them? I think we all know that, you know, people will always engage in unsafe sleep practice. And as I mentioned, being up against it with influencers, we have other family members. We've all heard the saying, oh, well, you slept on your tummy and it didn't do you any harm. These things do significantly increase the risk. And I think as professionals, it's everybody's business to be looking at safe sleep and giving those key messages to families, parents, carers. And I think in terms of, you know, how do we do that? This safe sleep risk assessment tool will really support those conversations, as Gina said earlier. It's a tool that will support practitioners, whoever you are, to identify where there are high risk flags. The tool will support practitioners to understand what safe sleep advice to give, and that we're all giving those up-to-date, consistent messages. It'll help you to feel confident having those conversations, because they can be quite challenging and difficult conversations. And whilst they always need to be trauma informed, we do have a duty to point out where there are increased risks to that baby. It's also supporting us to understand what advice is given and how we develop those plans, which is more importantly going to support that baby and that family to undertake safe sleep practice.
Okay, so an evidence-based approach. So it is vital that professionals understand safe infant sleeping arrangements and give families accurate evidence-based information. So advice could be tailored to the individual family circumstances, with an explanation that bed sharing is only a risk factor when in the presence of other factors such as smoking, alcohol and drug use, but that falling asleep on a sofa or an armchair with a baby is always dangerous. Almost all parents sometimes fall asleep whilst feeding their baby at night. So even if they don't plan to routinely bed share, parents should be advised of how to make their bed safe if they fall asleep unintentionally. Conversations need to include advice on the risks associated with adult bedding and/or allowing pets or children to share the same bed space. So the risk assessment tool that we're promoting today is a basic safer sleep information, and the tool gives links of up-to-date advice. It gives local sudden infant death statistics and the wider research, and it gives you guidance and information on how the tool can be used. It provides risk factors to help you inform your assessment, and it highlights any red flags of great concern. The information and advice for parents and links and QR codes, so they're available for the practitioner, but then can also be shared with the families. The tool supports practitioners to have the needs-led conversation and put a plan in place for parents, carers and families. So this is the initial red flag checklist. So if any of these red flags are highlighted and present, then further action is required. And that just mirrors some of the information that we've given previous in the presentation. We would then go on to use the full assessment tool if one of these red flags, one or more, has been highlighted. And it's quite a good visual. So the Family Nurse Partnership Programme piloted this assessment tool and found it very useful because it's a guide that's very visual for parents, carers and families, and it asks them the questions, so specific questions on specific risk factors. So, for example, do you or anyone in the bed smoke? So this includes smoking during pregnancy. If, for example, a family does answer yes to this question, then you can identify and share the up-to-date information of why smoking increases the risk of sudden infant death. And you can use the QR code or the information leaflet that applies to that discussion. So you can go through all the risk factors on this visual. It also gives an opportunity then that if a risk factor is identified, then you can work collaboratively with the parents, carers and families of what they can do to address this concern and address this risk factor. The assessment tool can be revisited at any time. So we can revisit if a risk has been identified and a plan has been put in place, then you can come back and use this resource to revisit those discussions and see whether they have navigated those risk factors and overcome those challenges and barriers of why they haven't been able to provide a safe sleep environment.
I think some of the key points that we want to highlight within this presentation today is research tells us from, child practice reviews and rapid reviews that as professionals, we are very good at sharing safe sleep information. It is evident that that discussion has taken place. I think where the out of routine report has highlighted, it's about taking it one step further. It's about developing a plan with that family or parents, carers, anybody who may be having care and responsibility for that baby when they are sleeping. Because the key message is every sleep needs to be a safe sleep, not just at night. So if you have a friend who may be looking after the baby and they may be asleep during that time, this plan that you develop with the parents should be shared with that friend or any extended family that may be coming into contact with your baby. The plan is the important part that you've developed collaboratively with parents to reduce the risk of unsafe sleep. It's about forward planning. You can see on the tool getting parents to consider things like if you are, you've got an event that's coming up that may require you to have alcohol, that you're taking that into consideration and you're developing a plan in advance to reduce the risks to the baby. I think we've also mentioned it's a multi-agency tool, and this is available on the Safeguarding Children's Partnership website, and we really want to promote its use within all agencies. I think another example of that would be if you work in drug and alcohol services, for instance, and you're working with a father who has recently had a baby and that they misuse substances. It's about thinking about that risk and having those conversations. Are they aware that them sleeping in the bed with the baby and mum and they've had substances does significantly increase the risk to that baby of sudden unexpected infant death? So it's those conversations, and if you don't feel confident to have those conversations, thinking about who you can contact, such as the health visitor or the family nurse, to ask that they make contact with that family and have those discussions. I think one more thing to highlight that Out of Routine told us, where children are within that safeguarding arena, so if they are subject to child in need or child protection plans, or indeed family help at that early intervention stage, if they're under 12 months of age, their risks are increased by nature of them being subject to a multi-agency plan, be it due to domestic abuse, neglect, any other safeguarding concerns, those risks increase. So it's about embedding safe sleep as part of that multi-agency plan as your standard practice, really, so that everybody is sharing those same key messages with those parents and carers and wider family networks on the importance of following the safe sleep plans. This last slide now will take you to further resources and support for parents. And I think the tool itself, as Gina mentioned before, has lots of QR codes. There are also apps such as DadPad and the Baby Buddy app that will also support those conversations to support parents to embed safe sleep practice within their daily routine. We thank you very much for your time.